what if the dengue virus keeps changing its version every year? How can a single vaccine still protect millions? That's exactly why the ICMR has launched India's first nationwide mapping of dengue strains, a development that is highly relevant for UPSC Science and Technology, Health and Governance. So, hello everyone and welcome to the latest update series of Mastoora IS. So, let's discuss about the topic. So, what is the news basically? So, as India prepares for its first large-scale dengue vaccine rollout, the Indian Council of Medical Research (ICMR) has completed a nationwide mapping of dengue virus strains. The study found that all four dengue serotypes are circulating simultaneously in several states and union territories, providing crucial scientific evidence for planning an effective vaccination strategy. So, why is strain mapping important? So, dengue is caused by four distinct serotypes, DENV1, DENV2, DENV3 and DENV4. Infection with one serotype provides lifelong immunity only against that particular serotype, not the other three. In fact, a second infection with a different serotype can increase the risk of severe dengue due to antibody-dependent enhancement (ADE). Therefore, an effective dengue vaccine should ideally provide protection against all four serotypes. Now, what are the key findings of the ICMR study? So, it is the India's first nationwide dengue serotype mapping exercise, and samples collected from multiple regions reveal widespread circulation of different serotypes. Several states and union territories have all four serotypes circulating simultaneously, and many other regions show the co-circulation of three serotypes. These findings will help design a scientifically informed vaccination strategy and strengthen disease surveillance. So, why is this significant? The mapping exercise will help policymakers identify dominant serotypes across different regions, decide where and how vaccines should be introduced, strengthen outbreak prediction and early warning systems, improve surveillance and targeted public health interventions, and support evidence-based vaccine policy. This marks a shift towards data-driven public health decision-making in India. Now, for the UPSC perspective, in prelims, the focus areas are dengue virus and its four serotypes, vector Aedes aegypti mosquito, role of ICMR, vector-borne diseases and basics of vaccine development. So, from the mains, it is related to the GS paper 2 and GS paper 3. The relevant themes are public health infrastructure, preventive healthcare, disease surveillance, vaccine policy, evidence-based governance, health security, One Health approach. And the way forward is expand genomic and serotype surveillance nationwide. Then integrate vaccination with vector control measures, improve early diagnosis and public awareness, and strengthen center-state coordination, build climate-resilient strategies for vector-borne disease management. So, at the last, I just conclude my words by just saying that this is not just about mapping a virus. It is about strengthening India's public health system through science. By understanding which dengue strains are circulating across the country, India can design smarter vaccine strategies, improve design surveillance, and reduce the burden of future outbreaks. For UPSC aspirants, this topic connects science and technology, health governance, and public policy in one important current affairs issue. So, this is all about the topic. So, I hope you like the way of my explanation and you like the topic. So, for further details, if you want to join our Telegram channel, so the link is mentioned in the description box. So, thank you so much.